Okay, hello, Laura.
We're very close today.
Yeah, we are so close. How are you doing today?
Good, thank you. I'm very good.
You're very good?
Yeah, I'm good.
I have different questions for the audience that have been... we usually get a lot of questions for the people, for men and women. But in these last 2 weeks, it's like, I feel like there has been a lot of people doing questions of some we gave answers in different episodes,
Okay.
but none of in all of them.
Okay.
So let's take a look deep inside and see what is your perspective from the technician.
From a technician's view.
Okay. So the first one would be for those who don't know you. I don't think there are not many that don't know Laura, but still, who are you and what exactly does a hair technician do?
Okay, so I am the head nurse here at the clinic. I am a technician, and technicians are the team that will be in the theatre when you're having a procedure. They will be helping the doctor, taking the hairs out and putting them back in, basically.
Okay. Yeah.
And taking care of you while you're in the room with us.
It's funny because you usually think that you are going to be nearby the doctor, well, at least in this clinic, because we talked before that there are a lot of clinics that doesn't have a doctor at all, which is like dangerous, at least. But the technician could be the person that is going to be with you all the way.
Yeah, from the beginning to the end. And the whole surgery. The doctor normally comes in for stages of the surgery, but the meticulous parts with the hair, putting them in and out, is technician normally. Some doctors do it on their own.
She would be the one that is going to solve all your problems and talk to you about all the doubts you are going to have and taking care of you. So it's interesting that you have a good feeling, no, with the technician.
Yeah, you have to have a good
feeling.
A good relationship.
Yeah, good relationship. Which brings me to what do you enjoy the most about your profession?
I like being in theatre, and actually I've got so used to it, doing it for so long. I enjoy so much when the doctor does a lovely design for the hair, and I get to place the hairs into that design and seeing it growing to the end and finishing the end of the surgery. I like that the most, placing the hairs. That's my most favourite part.
Ah, really?
Yeah.
I thought that it would be more like the companionship that you do with the patient, because the theater.
Oh yes, of course, that too.
No, it's because I feel like it's so scary, you know. Every time I get inside the OR and I take a look and it's like, okay, I just go a step back and step back.
That is probably the politically correct answer, but I really like putting the grafts in and making it beautiful so that those grafts grow in the design and direction that the doctor wanted, and it makes all the difference, honestly. The design and the placing, if it's done perfectly, the hair looks so natural you can't even tell anything happened.
Amazing.
Yeah.
That's good. Okay, what would you say is the most common mistake people make with the hair?
You mean taking care of it after the surgery?
Yeah.
Normally the most common thing are accidents and rubbing the area where we've just transplanted, because some people, for example, very tall people, they bang their head on the taxi getting in at the end of the day because they're still a bit numb and they don't realise, or when they're at home and they go to sleep and they rub their head on the pillow because the grafts are still quite loose under the skin for probably 4 or 5 days, so you can't have any of that. That's the thing.
And what do you do in that cases?
Well, the correct thing to do is, if you realise it in the moment, is to collect all the grafts that have fallen out, say they're on the pillow, quickly put them in some water, or if you have saline, not many people do, but just put them in water to hydrate them and get back to the clinic and we can place them in.
Okay.
If it's quick enough.
Okay. People usually do that or not?
No, it's not that common.
It's not that common.
No, I would say
they are
once
careful,
a month,
aren't they?
So 1 in 25 people might have an accident. 1 in 40.
Okay.
Yeah, it's not much.
Okay, I see. What signs indicate that we are starting to lose hair density or quality?
Density, you're going to see it in the mirror. and the quality when you touch it. So you can feel when you're putting your hands through your hair, if you're a woman and it's long, like I'm doing now, and hair is falling out, which is normal. You normally lose a couple of hundred hairs, and that's okay, but it's when you can see in the mirror, for example, you can see your scalp, something's different, or if your hair's falling a lot. But normally the quality is when you touch it.
The quality is when you touch it, and the density.
You normally can see it, or you can touch it, but normally you can see it in the mirror in front of you.
I thought about the density. That is something that to the women all the way when you're growing, they tell you like you have to look in the bathtub.
Yep.
So
and the shower head.
In the
but
shower.
For me, for example, I've started to. As I've gotten older now, here I can see in the mirror that it's starting to get much thinner on the sides. So I have here, but most females, they can see it in the mirror in the generalized female pattern hair losses in the middle.
Yeah, for me would be here.
Yeah, you can
like
see
this
straight in the mirror.
Yeah, I can
scalp.
see straight. Yeah. And in another places, I don't look that much, but in this one, this is the first sign that I found.
Yeah.
Sometimes it's tricky because it goes slowly. So it's not like just you just don't realize from one day to the other. So it's like you have to pay attention to that, right?
Yeah.
Many people think seasonal hair shedding is normal. When should we be actually concerned?
If it's going on for longer than normal for you. Normally shedding will happen for 1 or 2 months, but if it starts going on for a whole trimester or longer than is normal for you, then you have to think about that. The problem with shedding is that sometimes maybe if you have a stress, you shed later on, a few months after that stress.
Yeah, so that's interesting.
Exactly.
That's interesting.
So you don't, in the moment, the stress isn't falling out straight away. Mm-hmm. You have to think back and see what it was, if it was actual stress from that time before, the months before, or if it's something else that's going on.
Yeah, I want to make the audience remember that the first time you come to the clinic is for free. So sometimes if you are doubting because you are not quite sure about your condition, you can come here and just ask. Because as Laura says, sometimes it's a period of your life, sometimes it's pregnancy or after pregnancy, or in women cases there are a bunch of things that
it's more complex.
It's more complex, yes. And guys, it's less complex. What factors influence hair health the most? Genetics, stress, diet, product?
All of it. Genetically, yes. Stress, all of them. I'm sorry. So you have to just be careful.
No, you have to pick one. I mean, it's the question. No.
Oh, no,
just kidding.
Genetics, age. The thing is, there's multiple things. It depends on the person. You could have a young male that's having alopecia, normal genetic alopecia, and that's genetic. Yeah,
and actually the men that are coming here to the clinic, they become to be younger every year. Like at the beginning, the doctor told me that people that usually came here with like 50, in their 50s.
Now it's more
40s.
Fashionable as well.
And now it's much more fashionable.
Acceptable.
Yeah. People come early, which is
you have to be careful with that too, so you can stabilize the alopecia, not just go straight into surgery.
Yeah, I see.
But it depends on the person. If you're a man, you're a woman, you're old, you're young, you're suffering with an illness. So each of those points are valid, but it depends on the person's situation. Yeah. But basically, the main factors are genetics, stress, diet.
That's a good one. Yeah. What does the professional hair diagnosis involve?
Well, it has to be done by a medic. So it has to be done by a doctor who has training in it, and they will do your clinical history. They will probably analyze close up with some kind of magnification to see the surface of the scalp. What else will they do? Yeah,
that's interesting because they ask you for we ask you for a blood test.
Yes, we'd normally do analysis.
That is something that doesn't happen in another clinic, and it's important for you to know that there would appear a lot of data which is basic in order to do an intervention or something like that. So
with surgery, people don't realise that that's just patching one part of it. And like we said before, if you're young or old, it depends. But if you're a younger person and you're coming in and you just want to have a surgery, that's fine. But a lot of people want to know the root or reason so they can prevent, not just cure the area, because that's going to maybe keep expanding.
That is a behavior that women usually has, that is prevention. In case of men, we usually find the ones that are coming because they want the surgery, or the only idea they have in their mind is the surgery, and you have to know that there are treatments that you can have before having the surgery. Maybe they work for you, and then you are not going to need that surgery. Or yes, you do, but it's important. What technologies or tools do you use today to analyze the scalp?
So you can, like I said, have magnification. There's a thing called tricoscan, which is interesting too. And also, if it's something complex, maybe you would have to have a biopsy taken.
Ah, really?
Yeah.
In which cases?
For like alopecia areata and things like this, fibrosis and things like this, specific medical conditions, that would be checked with biopsy as well.
Yeah, when we talk about alopecia areata, is the one that you can see that there are like circles in your scalp that maybe they are caused because of the stress. This is a perfect example of a person that would need treatment, not necessarily get into an OR.
And recently we went to a congress, and there's a lot of misdiagnosis at the moment.
Ah, really?
With certain things, and there's a lot of infections that people are getting and they're not being treated straight away, and then they're going in for a surgery. So depending on, you have to really choose a good doctor that has experience, like we spoke of before, because before you have the surgery, we have to make sure that there's no underlying issues with your hair, your actual hair, and the skin as well. But yes, there's many different things, fungal infections and all these that are being misdiagnosed and being treated wrong. It's important.
That's why we talk so much about saying that if you have to be operated, do it just once. Because with the doctor we talk so many times about like the second operation or maybe the third or something like that. There are a lot of people that are coming here that has had an operation before. That's not quite the best scenario. I mean, the best scenario would be do it once and do it right. Or maybe you need 2 surgeries, depending on the area on your scalp that you're going to need. But sometimes it's complicated that because a doctor didn't see you or didn't have the experience in this area, you are misdiagnostic, and then.
Exactly. When you go into a clinic and you just have a consultation with a sales representative, that's just to have a surgery. And so if you're just going to treat your hair loss with just patching it with a surgery, like I said before, you could end up with a lot of problems down the road. And have to have like most of our surgeries now are the second ones that I have to fix or add more hair from the previous, which are harder to do and more painful for the person.
Yeah, and the results are not the same.
No, it's different because you have to work with the design or pattern of the previous surgery done by whoever to try and fix it a little bit.
You can check out some videos we have in TikTok with the doctor talking about this and commenting some cases that he has seen, which are really, really interesting. I strongly recommend you to take a look to that. For people who are starting to notice hair loss, what treatments are currently the most effective?
From my point of view, as a nurse, I'm not a doctor, so I'm just going to give you my opinion. It's medical treatment. It's the finasteride, dutasteride, and minoxidil are the only things that work efficiently against hair loss. Yeah,
for me, I always talk about I like to talk about my personal experience, because it's like when you're a woman, you're having so many hairdressers in your life, and I tried shampoos, mascarilla that I don't know how to say in English, mask, a thousand things, pills that are not necessarily from the pharmacy, the ones that are from the supermarket or things like that, and nothing worked. It was, I spent so much money in there, what was, absolutely useless, until I came here, and then I started knowing everything about the treatments, which are
medicine,
really,
which is not really spoken of much, but it is super important.
It's really important, and the people has been telling me, because I was losing so much hair, as I told Laura before here, and the people were telling me 3 months after starting, or so kind of like that, oh, you look, your hair, you look with so much hair, and they have been keep on telling me that in the last 3 years that I have been with the treatment, and I was thinking, this is much more cheap. It's cheaper than spending your money in trying 1,000 different cosmetics, 1,000 different things, and depending on the hairdresser, they are going to recommend you one thing or the other, because they work with a brand in that period of time, and they are pushed to make some sales.
Yeah.
So it doesn't make sense, because it is, as Laura says, it's going to depends on your genetics, on your diet, on the health. Yeah, you have to see that with a doctor. I mean, the other ways makes no sense at all, I can tell you. I'm going to the next question. So, how can someone know if they are good candidates for a hair transplant and when they are not?
Oh, that's a difficult question. I wouldn't know how to answer that. If they're good or if you've had a lot of surgeries before and the donor area is depleted, if you are having a stress, because normally after the stress the hair will come back. You have to make sure that your alopecia is a little bit stable, I guess. But there's not many reasons that you couldn't have one. Mostly illness or previous surgeries where the donor area is depleted.
Okay, I see. It's not that invasive, so it's not.
No, it's superficial.
It's superficial. It's not like aesthetic, you know. Like,
no, you're not cutting deep into the skin.
Of course, what distinguishes a well-done treatment from a miracle solution that doesn't work?
What's the question? What's the difference between a normal treatment?
And a miracle solution. Miracle solution, we have a lot on the internet.
Exactly, like everyone knows, if it sounds too good to be true, it's not true. And with hair, it grows so slowly, and anything that happens, you see it later on. Like we spoke of stress, it's months later that you notice a difference. So it's a very, very slow and boring process for the person that's waiting for the treatment to work. So anything that says that it's instantaneous, super noticeable, all these magic words that make you think, wow, it's not true. Everything's very
and
slow.
we learn about a lot about that with losing weight. So it could be kind of the same example. If they are, the promise could be like you are going to lose
20 kilos in 3 weeks.
then you're not in the right path.
Exactly.
Okay, what myths about hair treatments would you like to debunk?
Myths about hair treatment. The most famous one is that finasteride affects your libido. That one.
Thank you so much, because that's an important question.
Big one that they love to explode on social media. I don't watch social media. I just listen to other medics. We go to congresses and we keep up to date with all the medical treatments and surgical treatments that are available right now. And every single time the doctors have to present something explaining about finasteride and the fact that libido is a very, very, very low percentage, and it's very hard for them to make a good study to prove that it is actually the finasteride that's causing a depression or a libido, because a lot of people that come to the clinic and get a prescription for it normally have a depression, or they're suffering with something already. So it's extremely, extremely hard to just pinpoint it on that. And it's like here, I think how long have I been here? Since 2012, one person has has stopped taking it because they didn't want to take it anymore, and I don't even know if it was the reason for libido. It was for the reason of libido.
Yeah, you asked that in our social media channels so many times, and it's like complicated to debunk this myth, but you have to try. Sometimes it also happens with age. That is like some things you think it's because of the treatment, but maybe it's because you are already in your 70s or something like that, and it comes with a moment of your life with the whole things that are happening in your body that are not related with the treatment.
And you've got to remember, if you're taking it and it becomes the reason, which is going to be extremely rare, you can just stop taking it and that's it.
Yeah.
So it's not like a permanent.
And that's why you also need a doctor, because he's going to be the one like giving you advice about everything, all the problems that you can have.
And prescribing you the right dose.
Yeah, and that is also an interesting thing. The treatment that you get here is it's not a general treatment. It's that we were talking about the losing weight in 3 weeks and all that. That is like the general treatment for everyone. It doesn't matter if you are in your 30s or in your 50s or pregnant or not or whatever it is your situation. So here the treatments are absolutely different. They begin with you, your analytics and how your body is working, and they adapt all the treatment just to you. That's why that treatment is not going to work for your friend, because that is another thing that happens.
And if you take it over the counter as well, you don't know if you're taking the correct dose. Normally the capsules come one dose, you might need more, you might need less. You can't take a generic dose, but everyone can't take the same dose, and you need to combine it with them.
Yeah, for me it happens that I have so many girlfriends that were telling me, hey, give me your treatment, I can give me the pills so I can take the pill, and I was saying, no, because these are for me. I don't know if you are going to need the same or not.
Yeah, exactly.
Yeah, and I also don't know which is your case. Maybe you need them, maybe you don't. I mean, you have to. It's not something to take slightly.
Exactly.
What would a simple, realistic hair care routine look like for improving hair health? Does shampoo matter as much as people think?
No. The shampoo is purely cosmetic. It is going to clean your hair. It's just detergent. It's going to clean your hair. It's going to have some ingredients in it that can smooth the hair shaft to make it look shinier, make it look hydrated. It won't get in to hydrate the skin, it's just an effect. So the shampoo, you just have to pick the one that doesn't irritate your skin or dry out your skin at all. That's it. The one the fashion now is to pick things that are more natural as well, with less ingredients, which is good too. You don't need things with fragrance. But I would say no, I would just pick a gentle shampoo, wash as you need, and that's it. Conditioner if you need to smooth down the shaft of the hair.
We have the product in our online shop, so you can take a look.
Exactly.
And also you can ask the team. They answer all the questions through WhatsApp. So you can be, if you want to try but you are not sure which is going to be the best for you, you can ask them. So
exactly. And each product, it has, like I just explained, one product is going to smooth the shaft of the hair down better, so you have silkier hair. One of them is more specific pH level for a scalp that is irritable or it has dryness. So you just got to cater to the type of skin and the type of hair you have. But like everything, that is not actually going to do anything to your hair falling. That's just medicine. This is a purely cosmetic thing.
What everyday habits damage our hair without us realizing it?
Diet and stress.
I thought you were going to say the hairdresser, or not the hairdresser, but the dryer.
Oh, the hair dryer. Well, I don't know. It does really badly. You know, when you dry your hair often, it's going to make it weaker and break. But I'm thinking of the overall health of your head hair.
Your answer was better than what I was thinking.
Of course, if you don't want to have split ends, then don't blow dry your hair at 230 degrees every day.
Yeah, but it's important what you say about diet, because as we read comments and are reading about health, hair care all day long, we don't read so much things about diet.
And it makes a big difference, especially
they
if you're
are
oily
not
scalp.
related.
Yeah, exactly. The condition of your skin, your scalp as well, is super important. So, yeah, I think now diet is pretty important. A lot of people also suffer if they have certain vitamin deficiencies.
Yeah.
They suffer from hair loss. They're more likely to suffer from hair loss. So diet plays quite a big role.
Okay, interesting. Is there any product or ingredient that you always recommend? That could
No,
be
I just say balance. What with supplements? You mean? No, you just need the problem with
or
supplements.
also you can say you can talk also about products. I mean about diet, about something to eat or something. They talk about olive oil.
I think you just have to have balance.
Yeah.
A lot of balance.
Yeah,
Like
that
with
makes
everything,
sense.
that's the problem. You could be taking zinc and magnesium and maybe your body doesn't need it. How do you know? You have to have an analysis, and most people don't take a blood test before they start taking a multivitamin, do they?
Yeah, it's true.
So you don't know if you're giving yourself the right therapeutic dose or too much or too little, or your body just expels it and doesn't use it. You're just letting something pass through your body for no reason.
Yeah.
So if you keep everything kind of balanced and you're in good health, you keep an eye on your health.
Yeah, that happened with the spring, that people become low energy, so they sell you supplements or to be
Exactly.
high energy, and you have no fucking idea about what is happening inside your body.
And the supplements are super frightening now because there's so much coming out that because they're made in certain countries that don't have specific restrictions on certain ingredients or how they're produced, you don't know what you're putting in your mouth. If you buy something from, I don't know, online, you have to make sure it's been stamped in the country that you're in, and they have, like the European Union, have a lot of they hold on to a lot and take care of supplements. But if you're buying it from a country that isn't really into that, I know I've heard United States, you can buy a lot of things that are not allowed here, especially with cosmetics. So shampoos as well, there's a lot of things that are banned here that you can buy online from another country, and it's not good for you.
Yeah, complicated issue. What trends are you seeing in the world of trichology?
A lot of
Thinking about the future of the industry and all that.
Oh, okay. So now they're going on about cloning the hair and having a hair bank as well, so that you can...
Like Dolly, like the sheep?
Yeah, that's what they're trying to do.
Really?
They're trying to clone hair. They're trying to stop you from having grey hair. They're trying to work out how to...
That could be amazing. That would be super cool.
Yeah.
Really?
Yeah. They're the big things. They're pretty big because if they find out how to do that, then your hair transplant is going to be obsolete. You're not going to have to do it anymore. You're just going to do a treatment. I don't know how often, and you're never going to have a surgery.
Actually, I think the future about the hair would be the treatment. Would be for everyone to like. It's because it's funny that treatment seems to be new, and it's not new at all.
No,
it's not that much.
Before
But,
the surgery.
yeah, but there are a lot of people who have no idea about this kind of treatment. I have no idea. As I told before, it's been 5 years already, but I have no idea. If I didn't work with you in the past, I would have no idea. But I thought that hair transplant was only for men.
Yep, because I think that's a lot to do with marketing, because it's easier to sell to the men because there's obviously more of them that are losing visibly their hair from a young age, and they want to fix it.
Yeah, but then you realize when you start thinking about this thing, you realize that okay, I have seen women that are in their 80s or 90s and they have no hair, and I never thought about that. It means they are not that they have no hair, but they have really
fine hair.
Yeah, really fine hair.
The density is gone.
Yeah, the density is absolutely gone, and I never thought about that.
Yeah,
so
and
I
it's
think the
very
future
popular.
could be treatment for everyone, like
Exactly.
on a daily basis. Are people more interested in prevention now than before?
Yes, much more. much more interested in prevention. The only thing that prevents prevention is the cost, because the medicines are expensive and the consultations are expensive and all those things. But at the end of the day, it's better that you know all of your options than just being given one choice, surgery, and that's it, because like we've spoken before, you might be having a surgery to patch over something and you really need to know the underlying issue. Could it be a health problem? You know, you're not well, you have a change in your hormones for a female as well. That's really important.
I see. Well, and just closing the whole interview, I would like to ask you, what message would you like to leave to people who are worried about the hair loss?
If you're worried about hair loss, you need to go and see a professional, a doctor that's got experience. Do some research online, but be very, very careful, because now it's so popular, the hair loss treatment online. People make a lot of money from selling you products, so don't go down that road. You need to have a consultation and get some simple, basic information from a trusted place, a source, to know what's going on, really.
I would say that we have a lot of patients that are patients already, and I also have all the people that ask us every day about different things, that don't get paralyzed, because usually when someone has so many doubts about this thing that is so important for the way you see yourself and the way you get related to the world, it seems easy, but it's not. It's like a complicated topic. So I would say don't get paralyzed and come here to the clinic and just talk to the doctor.
You've got to also remember that not every hair transplant clinic has a doctor that treats. They just do the surgery. It's just a place to go to have your surgery done and leave. So those places are not going to be able to help you with finding out the reason your hair's falling out.
That's a good point. Yeah, that's a good point. And maybe you don't need the surgery. I mean, but
Exactly.
the thing that you're going to need a clinic that has all the options available for you. The ones that comes with the intervention and the ones that doesn't. So it's important, don't read everything that's appearing on the internet, because I just remember another question that a guy was asking us that was about the inflammation of the face.
Oh, swelling after surgery?
Yeah, swelling after surgery. That's another myth, another question that we explain so many times, that is it doesn't need to be that way.
No, it shouldn't happen, honestly.
We said it shouldn't happen, but it's so weird, because people usually see it on the internet. They are really, really used to it, that it seems like good. Impossible, but really it's something
that's something that shouldn't happen. It's very, very rare as well for it to happen.
And it's a point that paralyzes people for coming to the first visit or from operating.
Really? Wow.
Yeah, because they think in the after. So it's okay, I would need a transplant, but then when I'm going to be the next 2 weeks, on the third week, or if they have work, or they have to see people or whatever, they don't do the transplants just because of that. And it's not mandatory.
No, that shouldn't happen.
Yeah, just come here and talk to the doctor, so you can have a better picture of how you can be treated. No?
Yep.
Okay. Laura, thank you so much.
No worries, thank you very much.
I'm sure you're going to love to see her again, and maybe we do another episode next month. So follow us on Facebook, Instagram, TikTok, YouTube. Send us messages, an email if you need it, or even a WhatsApp here to the clinic, so we can attend you and be with you, which is what we like the most. See you soon. Bye bye.